Hello, everyone, and welcome. My name is Carol Scott, and I'm the Ombudsman Specialist for the National Ombudsman Resource Center. And we want to thank you for joining today's webinar on communication and advocacy during COVID and ensuring residents have access to the program. You are encouraged to eliminate as many distractions as possible for the next 90 minutes and perhaps start a list of things that your state or local program may want to do based on the information that you are hearing today. And you are also encouraged to chat comments and questions in the question box and chats about what your program is doing to communicate and advocate for residents. Next slide, please. Our goals for today are to explore the various ways the Ombudsman program is communicating with residents, families, and long-term care facilities, sharing the advocacy that's happening, encourage you to think outside of the box on how you can continue to be a presence in the lives of nursing home residents, and learning and recognizing that the Ombudsman program is a very powerful voice, and we must continue to speak out and up about the needs and wants of residents. Next slide. Our speakers today are Kim Palmore from the Texas Long-Term Care Ombudsman Program. She's the managing local ombudsman. Carolyn Tenaglia, ooh, that's close, that's gotta be close, Tenaglia, is the Northeast Region Ombudsman in Pennsylvania, and with her is Kim Shetler, Ombudsman Specialist with the Pennsylvania program also. Vicki Elting is the Assistant State Ombudsman in Washington State. Kathy Heron is the State Ombudsman in Rhode Island. Bev Laubert is the State Ombudsman of Ohio. And now I'd like to turn things over to Kim. So next slide, please.
Hello, everyone. The pandemic hit so fast that none of us were prepared. So the last visit with the residents, we weren't able to say something back and prepare them for nobody visiting them. And so by the first week of April, me and Vanessa, she's my other ombudsman, we both felt a strong desire to be able to try to see our residents. I had read a story where a young man had put his chair outside of his father's window at the facility his dad was in, and when I read it, I thought, you know, we could do that. So I made poster boards, and I put positive things on them so that some of the residents could see those. And I called Patty Duque, she's our state ombudsman, and she supported the idea. And I talked to Lisa, our AAA director, and Chris, our executive director, and they supported the idea. And Vanessa and myself, we got on, get out there, did our visits, and the residents were so receptive. We got lots of sign language, air hugs, blown kisses. It made us feel so much better just to be able to see that they were okay and that they were still happy and thriving. It did probably me and Vanessa more good than it did the residents. But that was one way that we had come up with that we could see them to try to make things a little bit better. We call the administrators at the buildings before we go, and they're very supportive as well. They, a lot of them would walk around with us, or they would make sure the windows were open when we got there so that we could see the residents. All the staff has been, we haven't had any negative reactions from it. You can go to the next slide. That's Vanessa holding up our signs. And then the next slide. Those are just some of the poster boards that we made to hold up for them. And I think there's one more slide. So we got very, very positive reactions. And like I say, the residents are very glad to see us. And,
today we will be going over how to join a Zoom meeting. We've got a couple questions, but we'll go through the first one by email.
So Kim, while you were doing these visits, did you have to explain that you were the ombudsman, or did they recognize you? Or was it mostly just a kind of hi, how are you doing? Or did you get any kind of complaints while you were doing this?
We never got any complaints. A lot of the residents recognize us, yes. We also would show our badge, and there was lots of sign language because, you know, we really couldn't hear each other well through the windows. Although I did come up on a resident that was trying to slide out of her bed, so I was able to call back into the building and tell them to check on her. So, I mean, not a lot of complaints can be worked through the window because you just can't hardly have conversations. But now they would recognize us and put their hands on the windows for us to put our hands up to the windows, and lots of smiles. And I think at that point in time, that's really, you know, it was that initial, oh my goodness, we need to see them. And that is kind of where that went. And we were, you know, we were able to see them that way. So
it kind of hit a fix for you and was very positive for the residents.
Absolutely.
Great, great. Okay, is there anything else you'd like to add about what your program is doing to communicate with residents?
Me and Vanessa both, we try to call the facilities and speak with our residents who are over the resident councils, you know, the presidents and things like that, and lots of phone calls and checking on them. I have a lot of residents in my phone that has cell phones, so I've been able to text, and that works really well. I have several residents that I text back and forth with, and they kind of keep me updated on what's going on inside the walls, so I can kind of get a little bit of information. So texting is good if you have residents that are operating their phones. Just that's, you know, you just don't have a lot of that.
Sure, sure. Libby, are there any questions at this time?
Yes, there are a couple of questions. The first one is, did window visits lead to any phone calls for complaints?
That could be possible because, I mean, we have gotten calls coming in. We did take also, when we would go to the buildings, Patty had a little thing where we made flyers to give to the buildings to pass out to all of the residents, which had our information on it, letting them know that we are still here and we are still available for you. So we would take those and give those to the administrators, and they would pass those out. And I know I did get a phone call off of the flyer that we had taken into the building. So I think that was probably pretty effective.
Great, thank you.
Another question is, did you do this at more than one facility, or how did you pick which one you went to visit?
Well, when we first started out, we wanted to do all of our facilities. And so we did all of them that were close by. The rain around here has prohibited us from going out, and because, you know, you're really walking into the areas that can get real muddy and they're uneven and things like that. So we had to think about safety as well. So we haven't done as many as we would like, but we are still on the trail of doing those when we can.
Okay. I think at this point we will move on. We've got some other questions that are coming in, Kim, so we'll come back to you at the end of the presentation and ask those of you.
Okay.
So this slide is showing guidance from the Illinois Long-Term Care Ombudsman Program for how their representatives were to do window visits. So their program, and you can click on the resource here if you are asking questions about how it was done and everything. I think that the tips and the guidance in this Illinois guidance is replicable to other programs. I think that the clear message here is that getting permission or at least talking this over with the state ombudsman to make sure that they don't have any guidance that they're aware of from the state or the CDC. I think at this point, window visits absolutely should be occurring in addition to any kind of outside visits. There are some other ideas that that programs have shared, have been communicating with residents includes sending out resident newsletters and making short videos. Next slide, please. And one of the new documents that, that the Resource Center has just put out this week is tips for communicating with residents, facilities, the public, families, and there is a link to this at the end of the PowerPoint, and it is on the website where all of these materials are being kept, and it's also in the COVID page of the Resource Center. We'll, like I said, we'll be talking about this a little bit later, but this is some good tips for how to begin a conversation, especially if you're talking with your volunteers and they are wondering, okay, you know, how do I do this when I'm not, you know, sitting in a chair next to their bed? It's been a while since I've done this. And so these are just some basic questions that might help someone get started in having a conversation, making sure that the conversation, the questions that are asked are kind of open-ended, and that the ombudsman be patient and wait for the resident to completely finish talking. I know that some of us are kind of gabby, and we tend to jump in and when we've got something to say, but as we know, sometimes, especially if the residents haven't been having a lot of communication with outside people, it may take them a little while to get into thinking of their answer and providing it. Next slide, please. So Katie, if you will show this is an example of a video from the Kentucky Ombudsman Program.
The Long-Term Care Ombudsman Program advocates for residents living in Kentucky's nursing homes, personal care homes, and family care homes. The Long-Term Care Ombudsman is not visiting right now, but if you have questions or concerns, you can call us at 1-800-372-2991. Your sacrifices are making a difference. We are flattening the curve. We will get through this, and we will get through this together.
Thank you, Katie. I think that's a great example of a message that we can't visit, but we're still available. And so appreciate very much the team in Kentucky, Sherry Culp and her staff and volunteers. Next slide, please. So how important is it that the Ombudsman program continue communicating and advocating for the rights of residents? This photo was taken by a regional ombudsman outside a nursing home in Minnesota. The bottom line reads, "Set us free." So they need us. They need us. Next slide, please. In Alabama, the Central Alabama Aging Consortium sent cards to every resident in their Tri-County area. Signs and large cards were sent to the nursing home for children, and representatives are participating in weekly parades. I'm wondering, has anyone else been involved in the parade? If you want to chat that in, feel free. I know that there's been several parades in my town here in Missouri, and unfortunately I don't hear about them until the next day when there's pictures in the paper, and I'm like, darn, I would like to do one of these, although I don't know where I'm going to get my balloons from, but I would find a place. Next slide, please. In New York, volunteers identified residents that the program had been in touch with recently. They reached out to residents who knew or know what's going on in the facility. These are residents who might work in the volunteer store in the facility, or frequently sit in the lounge, or who are just friendly with all the other residents. They sent them these letters with their business cards and brochures, and this outreach led to several phone calls with news of residents or concerns that were followed up by phone calls to the nursing home staff. What a great idea to identify residents who kind of are in the know and who you can speak with, in addition maybe to the the resident council president. And that leads us to talking about resident and family councils. So next slide. This is just a list of the, I polled the state ombudsman and asked them how they or local programs were communicating with resident and family councils. And these are the answers that they responded with. Most states are doing all of these. I think the Zoom meetings have been an experience. I think that the statewide and regional calls, I think, is of particular interest. And this is a perfect opportunity to start using those names of the presidents, especially of the family council, to begin development of a family council in particular facilities. So I hope that that is something that all of you are talking about, figuring out how you can get 1 or 2 or 3 families together through maybe Zoom, and then get the facility to help publicize getting in touch with one of these family members and helping them schedule a meeting so they can begin the conversation of their ideas, their wishes, their concerns, and their solutions to those concerns. Next slide. Oh, so what I'd like to do now is turn this over to Carolyn and Kim to talk about work that's being done in Pennsylvania.
Hi, Carol. Can you hear me okay?
I can.
Okay. Well, if you could advance to the next slide, we're going to tell you a little bit about our virtual family council. We're thrilled to be able to go over this information with you today, but we wanted to stress that This is the first time that we've moved something along from idea to reality so quickly. So we're learning as we're going. We found some issues along the way. We've made some tweaks, and I'm sure that there are even more tweaks to be made. But right now it is a weekly statewide online gathering of families who have loved ones residing in long-term care. So it's a way for them to connect with the Ombudsman and each other, and it's also a way for us to share resources and support. Next slide, please. So traditional family councils are usually specific to a particular facility and often developed and facilitated by a facility. And admittedly, here in PA, the prevalence of family councils was minimal and something that we had always wanted to do more with. When the pandemic began to impact everyday life and long-term care so significantly, we were suddenly presented with a variety of situations we had never anticipated, and neither did the families. So families who may have never connected with an ombudsman or perhaps have never even heard of an ombudsman were looking for us and seeking assistance. Our local ombudsman's phones and emails were seeing unprecedented activity as we increased efforts to make community aware of our office. And when we started to look at our Ombuds Manager data, we were seeing that we were receiving approximately 300 information and assistance calls per week from individuals, and at least that many from facility staff. The number one request for information was regarding COVID. So we started to look for a way that we could do something other than say there's not much more we could do. So we brainstormed and we decided that the best thing we could do for these families is to try to help connect them to our office more regularly and to each other virtually. So we decided to try this statewide virtual family council via Zoom. Next slide, please. So we sent an email to our statewide network of local ombudsmen looking for some who might be interested in assuming the role of facilitator. And we were lucky to connect with a very seasoned local ombudsman from Blair County, Altoona, Pennsylvania. Her name is Jamie Rose. And she has had some graduate work with facilitating, and she's doing a very, very nice job. So the next thing we did was we sent out a request to our locals, and we asked if any of them had any interest in being on a work group to develop the council and to help keep the momentum going and direct it moving forward. So we currently sit at 20 members, and I'm proud to say that it is a combination of local ombudsmen, volunteer ombudsmen, and now we have 3 family members who came forward from our meetings to be part of our work group. So initially we met, we discussed what the meetings would look like, how they would be facilitated, how long, et cetera, et cetera. Our initial plan was for twice a month. We were going to do it for an hour. And we set up a Zoom account with 100 available slots, and we thought that would be more than sufficient. However, after the first meeting or two, it was obvious that we needed more capacity and more frequency. So we now have over 300 families on our listserv, and we had to increase the frequency of our meetings and the time for each meeting. So after we had our initial structure figured out, we developed a press release and a postcard, and we shared that across the state. We also developed a corresponding Facebook page so we could have a social media presence and somewhere where we could house and share resources. The materials and the Facebook pages were shared with the entire Ombudsman network, legislative offices across the state, all our sister agencies like the Department of Health and the Department of Human Services. We also shared it with providers and any family that had connected with us for assistance or information. So we also solicited and engaged the press. We did several interviews for newspapers and even television. And because it was such a hot topic at the moment, we were very fortunate to get the word out to a large number of people across the state. Next slide, please. So taking a look at some of the logistics, the next consideration included like how do we get the actual connection information out to the people that wanted to participate, and what would meeting follow-up look like? So we decided to not just share the link publicly. We wanted to really try to control the presence of people outside of the targeted audience. We didn't want to have a lot of facility staff and a lot of press. So we decided to ask anyone interested to email our office and to use Virtual Family Council in the subject line of that email. And when they did that, the email would trigger an automatic response that contained the connection information and instructions. That automated message also provides some basic guidelines regarding the purpose of the meeting, confidentiality, and stressing the fact that we cannot guarantee confidentiality in a virtual setting. The actual conduct of the meeting now requires 4 ombudsmen, 1 to mute and unmute participants, 1 to monitor the chat for questions and comments, 1 to scan the participant screens to see who's got their hand up, and 1 to facilitate the conversation and content, and that would be Jamie. Admittedly, our first meeting was a little chaotic, and we learned as we evolved, and we have now created this multi-person approach, and so far it's working pretty well. After each meeting, one of us double checks the meeting chat feature for anyone seeking to contact their local ombudsman or anyone that expressed a concern that seems to need some sort of follow-up. By having the participants email us for the link, we now can easily get back in touch with them. And like I said, we have an email list of over 300 families now. So prior to every meeting, we can send out resources, we can send out meeting announcements, and it's working pretty well. So I'm going to hand it off now to Kimberly.
Good afternoon, everyone. Carolyn, can you hear me good? Awesome. Okay. So next slide, please, Katie. Thank you so much. So as we got going on all of this, we also realized that one of the things we really needed to do was evaluate our response throughout the process, making sure that we were meeting the needs of the folks who were joining our Zoom virtual family council meetings. Family members at the onset requested to increase the frequency of our meetings to weekly rather than bi-weekly because this COVID-19 situation was evolving so quickly and guidance was changing so quickly during the months of May and June that folks really felt they needed that connection to us. They also expressed to us right off the bat that meeting for 1 hour wasn't sufficient. They wanted 90 minutes, and so we've done that. Carolyn mentioned we had to increase our Zoom capacity, so that required us to expand the number of lines that we could open on Zoom from 100 to 500. We've also established a Facebook page, as Carolyn said, with several features, but one of the beauties of having Facebook as a platform that we connect with our virtual family council members is that we're able to get some Facebook metrics. And I don't know if you've ever really dug deeply at the statistics that they can provide you, but it is absolutely fascinating. And I'm going to give you some of those details in just a minute. Next slide, please, Katie. So this is just a summary of some of the topics that we've covered and have scheduled for our virtual family council meetings. Obviously, we spent a good bit of time our first round, our first meeting or two, talking to folks about what is an ombudsman, what is our role, how can we be helpful to families and residents of facilities. We did an entire session on alternative visitation and what that looks like in the pandemic world. Utilizing technology and window visits and so, anything that was creative and out of the box. We did a whole session on advocacy and invited folks from our Consumer Voice National Organization to join us and dialogue with families about the concerns that they have for systems advocacy during COVID-19. We focused with the Alzheimer's Association on dementia and resources for families that have been impacted by this. And we also provided a licensed social worker who is well known and can really get in deep with the serious concerns with trauma and isolation. And so the families had an opportunity to hear her presentation and dialogue with her last week. We are also giving families an opportunity to connect with some high-level decision makers within the Commonwealth of Pennsylvania. So I'm happy to say that this week they're going to be dialoguing with our executive director of the Office of Advocacy and Reform, which is a fairly new office within state government here in Pennsylvania to deal with folks who are in what they call high risk or at-risk populations. And so the executive director of that office is going to talk with family members tonight about the future of long-term care post-pandemic and some of the issues that they've been going through during the pandemic. We also are bringing on board in the very near future some folks from the Attorney General's office to talk about resources that they could provide. And we also have a senator from the state legislature joining us in a couple of weeks to talk about the aging subcommittee and how family members can provide advocacy in that regard. So next slide, please. So this is just a slide that shows you visually a little bit about the Facebook metrics of our Facebook page for the Pennsylvania Virtual Family Council. So far, it gives us some really significant information about the number of people we're reaching, approximately 3,500 people per month. And this would include anyone who opens, looks at, clicks on the page, or has content from the page shared with them from someone else. The post engagements, so every time we post something to the page, we're averaging about 225 people touching those posts. And then the daily page reach for the month goes anywhere from 586 people a day. The high during the month of June was, May was 3,500 people in one day. So these are all potential people who may not have known anything about our Ombudsman program in Pennsylvania before they somehow touched our Facebook page. And so that's really exciting. I'm a numbers person. For those of you that know me, you know that numbers fascinate me, but the fact that we could possibly be reaching an entire population of folks who knew nothing about the Ombudsman program before is extremely exciting here in Pennsylvania. Next slide, please, Katie. So we've also had some really unexpected outcomes and obstacles and challenges along the way. As you can imagine, with anything that's new, there's always things that we learn as we go along. So the Facebook page, we realized early on we needed to add an additional feature to that, which was a social media platform where folks could really dialogue with one another and organize. So we added a chat group or a grouping to that Facebook page that was for family members only. So they have to answer a few challenge questions before they're accepted to that Facebook group. And they have been really dialoguing back and forth and sharing resources. Again, that takes a significant number of us serving as administrators to kind of monitor that chat and respond to questions and concerns as they come up. One of the major obstacles to pulling this off is time and resources, as you can imagine. We have to be available to people and to answer them in a timely manner. So right now we have about 8 ombudsman staff, some from the state ombudsman office and the rest from our local ombudsman entities who are set as administrators and are working on that response on the Facebook page. The other thing is that we've had some technology challenges, and of course there's been at times presence of staff or reporters or outside entities who are on that call because we really can't 100% regulate the virtual family council because we've done it in a public platform kind of way. Next slide, please, Katie. And last but not least, some other really positive, I think, unexpected outcomes, and Carolyn touched on a couple of these as well, is that it's been an amazing learning experience for us to take something that typically would happen facility by facility and to put it out there in a global Commonwealth-wide platform was a significant challenge and a huge learning curve for us, and a lift that we did as a state office team with the help of our local entities partnering with us in 2 weeks. So that's a pretty remarkable accomplishment. The opportunity for us to engage in systems advocacy in a way that we had never thought before, and that is by connecting family members to decision makers and making them part of the solution. So, you know, from where we sit, that is really what our charge is. And so this is just a natural unexpected outcome is that we are making that happen. The other thing that I think is super exciting is, as Carolyn said, this list of 300 additional family members and people who have contacts with loved ones in long-term care who now know about the Ombudsman program, and who we in turn can now provide to them resources, media blasts, and survey potential. So this is a huge opportunity for us in Pennsylvania to connect with people that we would not have had another opportunity to before. So while the pandemic has brought us a lot of things that have had some really negative outcomes, for us, this has been one of the positives in our work as Ombudsman. And with that, I'll pass it back to Carol.
Great. Kim, thank you. Carolyn, thank you. I think I was on one of your first calls, and it's always interesting when people, some of the family members were like, oh, we have this great idea. We should get the families from our home together. And you just want to go, how do they not know that they could have a family council going? So I think that's maybe even just the simplest thing that you would think you could kind of skip by that and go on. You guys did a great job of recognizing that and changing your structure, changing your frequency. I would imagine that there are some people who might be interested in listening in on one of your calls. Is that permissible, and should people contact one of the two of you to ask if they can sit in?
Absolutely, that's fine. Or they can even get on our page. They can get on our Facebook page and they can request access to the meeting directly from there. It'll give you a link to contact Jay Rotz, who is our administrative assistant, and he will send out that auto response link to anybody who makes the inquiry. So yes, Carol, that would be great. And that's one thing that I didn't mention, but I do see, is that this has opened the opportunity for family members to really pursue family councils in their own facilities. And we see that this could potentially, given this is a really unpredictable situation with the pandemic, this could be something that goes on longer than just a short term for us. So we're already looking at that from a long-term perspective on our list of to-dos and how we're going to spread that work out across our team. So it's definitely, it far exceeded our expectations. I can certainly tell you that.
Now, we do meet every Tuesday from 4:30 until 6. I put Jay
Eastern
Ross,
time.
Eastern time, that's right. I added in the chat Kim's email address, my email address, and an email address for Jay Rotz. If you email Jay and you use Virtual Family Council in the subject line, you will automatically get that connection information and you can join us anytime. The link works for all of our meetings. So it's a recurrent meeting. So once the families have the link, they're good to go. They can pop in for all of them, some of them, one of them. It's very fluid. But by getting that link, then we have their email address.
That's perfect. I'm thinking that what a great resource for families that don't live near their loved one, to be able to connect, to get information, and to connect with other families eventually within the area that their loved one does live in. So we'll be watching as you guys roll out more ideas and everything. And I want to thank you guys. So thanks.
You're welcome.
The one thing I would just throw out there, Carol, is we are now in the process here in Pennsylvania of having those conversations about reopening nursing homes. And so this connection with these families is providing us a way to bring their voice to that conversation. So we're learning an awful lot from them, and it's really good that we have that resource right now.
Sure. Katie, are there any maybe one question that you'd like to throw out to these two?
Sure. What type of question?
Libby, I'm sorry.
That's okay. What type of questions did you have family members answer before being added to the Facebook group page?
Oh, that's an excellent question, Katie. We made it really simple. So we just asked them very specifically, do they have a loved one that's currently residing in long-term care facility? And I think the second question was, is your loved one residing in a facility in Pennsylvania? So they were very generic questions, but it was just a way for us to kind of screen them a little bit rather than just everybody jumping in. And so we have to hit approve before they get into that chat group.
And then just one more question. I know you mentioned that sometimes staff members would get in on your calls. Did you have any kind of filtering process because you used the auto reply email?
We did actually, there were 2 emails. God love Jay Rotz is all I can say, because he reads each email address. And so even if there is an automatic response, he keeps track of those emails, and he flagged 2 of them for me that had facility email addresses. So then I had their email addresses and I followed up with them and I asked them why they were interested, and we kind of headed it off at the pass. So yeah.
You know, even a person who works in a nursing home could be a family member.
And,
We found out,
So,
right.
yeah,
There was
have
one of
several
the
of those.
2. One of the 2 had a family member,
Yeah.
so one got in and one didn't.
and we really did try not to exclude people for that reason, Carol. And you know, it's funny, we even have someone in the group now who's who works for a federal senator's office, but is also a family member. So it's like there's all these unexpected links, so to speak, or direct links to getting people connected to the right people. So it's exciting. It is really honestly very exciting. You never realize, you know, like they say, it's a small world, but it really is. And that's really championed our cause up front in the legislature too. They really, I think we have a little bit more recognition now than we did before about what our program's about.
sure, because maybe at some point you can get that senator to do a PSA or to do a letter to the editor for the newspapers talking about joining the Ombudsman program. That might make a really good recruitment technique.
Mhm.
Okay, we need to move on. Thank you too. We'll be back to you with, there are many other questions that are coming in. So ombudsmen across the country are using Facebook. And I forgot to mention at the beginning that we actually are, for the first time for NORC, we are live on Facebook right now. So if you go to the NORC Facebook page, you will find a recording of this event, or if you're out and about and get on Facebook, you'll be able to be watching it live. But many programs are using Facebook to share information, and they're being interviewed by newspapers, radio stations, television stations. Patty Ducaye, the Texas State Ombudsman, was quoted in USA Today in a story called "A National Disgrace: 40,600 deaths tied to nursing homes." Several state ombudsmen have been invited by AARP to participate in their state's AARP Facebook Live events. And if you haven't already reached out to your state or local AARP chapter, you might want to do that. Ask them if you can speak during one of their meetings. You may find some people that are interested in becoming an ombudsman volunteer. AARP has always been a great source of potential volunteers. Lori Brewer, who is the New Jersey State Ombudsman, told us that she's been doing a lot of press interviews every week. Every week, she says, I am focusing on different aspects of this pandemic and how it is affecting long-term care residents in New Jersey. I am starting to shift my message points toward things that must be done in the long term to reform the long-term care system so that the system is better prepared, but also because it is a system sorely in need of reform on a good day. So with that, next slide, please. So again, there are a lot of things that individual programs are doing across the country that are working. Most programs have contacted facilities requested the contact information, either the cell phone or email addresses for residents and their representatives. Feel free to chat in the chat box any solutions or tactics that you would take if you were faced with one of the roadblocks that are mentioned on this slide, where residents cannot get email or don't have use or access, facilities are not familiar with Zoom and other communication tools, people reporting that the phones at the facility are not being answered and the voicemail boxes are full. What is it that you have done in your programs when faced with either a technology information or a phone box, a mailbox that's full? And while you are thinking about those and typing it in, let's go to the next, actually, let's go to Vicky's handout. And we're going to hear from Vicki from Washington State regarding work that they are doing. Vicki. Vicki, you are muted.
Sorry. Good afternoon, and it's morning still here in Washington. But I've learned so much just listening to my representatives in other states, and I am really glad you mentioned staying in contact with residents and getting contact information issues, because that's where we've stumbled a lot. In fact, we started out by sending instructions to all our local ombudsmen to call the facilities that they serve and ask for contact information and room numbers of residents who live at their facilities. And that's been a really interesting exercise, in that we have had a lot of trouble getting that information, especially for our adult family home residents who live in small homes, 6 or fewer residents, and they have been not very communicative. We've used the telephone to call them, and we've also sent out letters asking for that information. But you know, it sometimes takes more than one ask, and we've persisted in that way. But I think it's very key that that's where you start if you want to be in contact with residents. I really appreciate the whole family council presentation, because we haven't done that, but now I see that's another way to get actually contact with residents. We have done a lot of postcards, mailings, and our volunteers have had kind of virtual Zoom meetings where they write postcards together while they're on the Zoom meeting. And that's been really great for the cohesiveness of the volunteer staff, who don't see each other either, and also for getting the attention of the facilities. Phone visits have been very difficult for the reasons already mentioned. A lot of facilities have very inadequate phone systems that really go against the resident right to have contact with the outside community. And so we do try to reach into social workers, activity directors, and family council, resident council members to set up meetings like Zoom meetings. But we haven't had very much success with that either. We've done that, again, by calling the facility, and then if not been able to talk with residents, we've talked to the administrators, and that seems to get their attention. Our window visits have been somewhat successful, although there was quite a bit of confusion in our state about whether they were allowed or not. And so we've had some we've had to go to licensing for that, and I think we've got the message out now that they are permissible, but it took a while. The last thing on the list that I really wanted to tell you about in more detail is a project we've had called the Tablet Project. So on our Facebook page, we have done a fundraising effort to fundraise for facilities to receive tablets from the Ombudsman program. So we started out with about $5,000 in donations, which was great. But we soon had a long list of facilities who had requested a tablet, but we don't have enough money to buy them all. So we're still in the process, and we buy them as we can. We're also going to use some of the CARES money to buy some tablets. So we'll see how that works. When we have been able to use the tablets in one or two of our regions, it has been somewhat rocky in that you have to get the attention of a staff person, prearranged, who has the time and willingness to take the tablets that we bring to the door and take them to the residents. And that's been difficult for some facilities because they are so busy. But we've recognized now that we need to actually reach into activity directors and again social workers who are may be more likely to get the tablet to the resident. There are some problems with cleaning those tablets if you're passing a tablet from resident to resident. So there's infection control issues that have had to be worked out, but we've actually supplied some cleansing towels, throwaway towels that can go with the tablet in a plastic bag into the facilities. So that's really what we've done here. We wish we could do more. I think the family council, virtual family council idea is, I think, what we want to do next. But thank you, and I'm happy to answer any questions.
Great, thank you, Vicki. I'm sorry, Libby, go ahead.
I was just going to say, what responses have you received from your postcards that you've sent out?
We've had a lot of phone calls into our state office thanking us for the phone calls. We have not received any messages saying I want to complain about something, but we will then identify that person if we have their contact information and try to call them ourselves. I think the other thing that's really a great idea that we are just now using is looking at your Ombudsman as your complaint and consultation data and reaching in to residents who have, or their families who have made complaints or asked for information before. And that's in process now, and I think is working quite well. One thing we have noticed is when the virus first started, we had no callers into the state office. And we were very, very concerned about that. But actually, we did have a town hall meeting and for all the ombudsmen in the state. And that sort of has whipped up a little more business for us. And now we're getting more calls than we ever have, and mostly about the reopening, because there's a lot of people who are very unhappy about their loved ones not receiving any visitation or contact with the outside world. Our governor's been very strict about those contacts. So anyway.
Thank you, Vicki. We're gonna move on, and we'll ask you some more questions. There's a lot of information in the chat that I think all of us are gonna have to take some time thinking about. So next slide, please. Thank you. So this is a quote from Cheryl Hennon, who is the Minnesota State Ombudsman, and I'm just gonna read it. She says, "I meet once per week with my staff. Each week, our work seems to take on another level of grief. This week, the unfortunate topic of suicide ideation leads the top 5 concerns. Residents expressing more often the wish for death, much in part due to the effects of isolation and quarantine. We as ombudsmen continue to fight for compassion care visits. I realize there is a balance, but we need a strong voice to communicate the important resident stories that reflect the effects of COVID-19 and the response to COVID-19 has on residents in long-term care facilities. I think that's, I was just struck by what Cheryl is saying here, and I think this is a concern that all of us have, that, what is the effect of people not being able to see their family members. And as much as it's hard for us not to see these residents, the fact that the families are not able to see them is heartbreaking. And I am loving the stories about the outdoor ideas that facilities are coming up with, where they've taken big sheets of plastic, heavy duty plastic, hard plastic that you can look through. They put benches or tables and chairs on each side of this, so that you really are kind of around the edges and over the top. You're with them in the same space, you just can't touch them. And I saw that somebody had a question about huggable cloth. I did read a story somewhere where families were able to put on some kind of gown or covering that allowed them to actually hug their loved one. But I don't remember where I saw that, and it might not even have been here in the United States. So next slide. And what we're going to do now is we're going to talk about systems advocacy and how communicating with people who make guidance, who can enforce laws, is such an important part of being the spokesperson for the residents. So at this time, I'm going to turn things over to Kathy Heron, the State Ombudsman in Rhode Island. Kathy. Are you there? Katie, can you help her?
Sure. Let me see.
Kathy, we can't hear you. Oh, man.
I'm back on.
Oh, perfect. Thank you.
Stupid mouse, the light went off in it. Can you hear me now?
Yes, please
Okay.
proceed.
Oh, all right. Good afternoon, everybody. Thank you for having me on this call. I want to share with you some of the things that have happened in Rhode Island. Much like, your states, we've gone and we've tried to do a lot of contacts with the residents through cards and phone calls. We spend a lot of time with the families because they call us directly because the Department of Health has advised them to do that. And any kinds of things that are coming in that a community person, needs to go to a long-term care facility, the Healthy Aging is sending us, the referrals so we can check on them once they get there. There's been a lot of, as I've noticed, a lot of people that have resorted to heavy drinking, which led to self-neglect, which led to falls. And when people can't communicate with them, they usually send the police in to do a healthy check. And the police have been finding out that they've been on the floor and they haven't washed up, and people have not been in to see them. And they do have family members, but it's just that they've lost contact with them. So there's been an awful lot of alcohol and drug abuse going on with our elderly, which some people think that that's, unusual. It isn't. We have a large problem here in Rhode Island with that type of abuse. But about several weeks ago, we started getting phone calls in, myself and my staff, about stimulus checks that weren't being given to the residents. And it was both in long-term care nursing homes and assisted livings. So because I work very closely with the Rhode Island Attorney General's office, I emailed two of the people that work with General Nerona and gave them the information. Because I didn't know whether or not this was just Medicaid, I didn't just turn it into the Medicaid unit, I turned it into the adult complaint line. And they started to look at the list, and then they started to get a few phone calls too on their own. And they took the problem to General Nerona. He's been a very, very helpful and a good Attorney General since he took the position, much better than some of the ones we've had in the past. And if you go to him and you have a legitimate problem, he will tell you that he will do what he can. And sooner or later, he did come out with an article that went into the journal. As Carol knows, I write a monthly article for the Senior Times in Rhode Island, and it's a statewide newspaper that kind of gets people information that they need to know. The past couple of months, I've been writing about our office understanding their frustration, not only with the visits, but with the deaths and with the way life has changed. So this month, next month, when the newspaper comes out, it'll actually have a small statement from me, and then the letter that the senator in Washington sent to the IG, Chuck Grassley, complaining that he wanted this stuff investigated. So that kind of made it even more interesting for our Attorney General to get involved. So he did have coverage in the newspaper. It did go on local Prav. And what we decided to do in this office is, because people sometimes hear something and they said, oh yeah, right, but never think they're going to get caught. So we started making a list of the homes that we thought might have problems. And I asked my staff to call these homes and ask them a series of questions that I had created, and asked them to write the response down. And we just finished the first batch this afternoon. My staff member did a really good job on it. And we sent that over to the Attorney General, so that I noticed that there was one on there that they caught keeping somebody's check. And the response they gave my staff member was, oh, yes, we know what to do. And my biggest concern was, what were they going to do with the dementia patients who didn't have anybody to help them make a decision? What were they going to do with that money? And I just wanted to remind them all that they still have an obligation to keep that money aside and make the quality of life of their residents better, whether it be a hearing aid, whether it be paying for a funeral bill. It wasn't their money to keep, because in a year it had to go back. So why not take it and do what they could to make this person's life a little bit better while they're living in a nursing home? We had, CMS say that we were going to get CP money and we were going to be able to do this and that. And then when they finally came out with what we're going to do with the CP money, like in a lot of states, it's going mostly into government things, and very little of it is going to be spent for the residents. So when we heard that, I just kind of said, well, it doesn't surprise me. And, you can buy iPods for residents, but the iPods aren't any good if, like somebody just said a while ago, if the staff isn't willing to go in and help somebody use it. And we've had that challenge where they have not wanted to go in and do a FaceTime with the family. And then I call up, and when my staff can't handle it, I'll call them up, and then I'll say, this, that, and the other. But at least this stimulus money, I felt, could give them some things, maybe a brand new television that they've never had. They've had somebody else's, hand-me-downs, maybe an air conditioner for their room. But I wanted to make sure that's what happened with it. So we took our first batch of questions back, and now the AG, and I'm also working with the United States Treasury. There's an agent there that heard what we were doing and has been in touch with me. And she was in touch with the senators and the representatives. So they've been calling me when they have things. So we've got this kind of like a little circle of things that we're, able to reach each other and send each other information. But I think it's one way to be sure that these residents are going to be able to spend their money. They don't have anything else as far as right now. Some of them ask the facilities to hold on to it until they can go back out again. And then we had the group of families that thought the check belonged to them. And they would call and, they couldn't get any information on the money. I talked to them, a couple of them last week, and I was just, usually I could be not as polite as sometimes we all know, but I was very polite with them. But I told them, you can't say that this, money is going to be given to you because the resident owes you money. You have to have slips for something that you're going to go in and say that you want to be paid back for. Oh, yeah. And of course, one of them reported me to the Department of Healthy Aging, but we had all of our notes put together about why we were doing this, and then we sent them all the information that I'm sharing with you today. But, you've got people that think that they can collect that money and, they can use it for what they want, or they make up these fictitious stories about what they bought. Now they need to be reimbursed. Well, I want to see slips. I want the facility to get slips for it. That's important. And then the residents have called. We had one resident call Congressman Langevin's office today, and she called me. I sent it over to the AG, and then I sent it over to the Treasury in Washington, the agent there. So, the AG will warn them that there could be criminal charges. But I think what's going to be even better is the Treasury Department will probably go down and audit them, which is what this one facility needs that the complaint came in for today. So that's what we've been working on in Rhode Island as far as that goes, to be sure that the residents get their stimulus checks. As soon as they publish the article in Senior Times, I'll send it to Carol, and she can distribute it to you if you're interested in seeing it. Any questions you'd like to ask? Carol said I talked fast. I was trying not to.
Yeah, no, you were perfect. Next slide. I don't remember, Kathy, if these are your questions or if they
My
came from
questions
somebody else.
that I thought of, yes.
Okay,
and this is
great.
what
So
we asked on the phone calls.
Sweet. So if anybody's interested in starting a program like this, again, if you're a local program, you want to be sure and talk with your state ombudsman before embarking on an effort like this. But, there have been several people who've been typing in congratulations and good job. And that's my 15th daily call I get from telemarketers, and I apologize so much for the background. Next slide, please. Ugh. So here are some resources from the Center for Medicare and Medicaid. And I'll tell you what I'm going to do.
Hi, I can't do this phone right now. Please leave a message. Thank you.
So that was my opportunity, my one last chance to get my student loans paid off. When I graduated 45 years ago, my God, if I still had student loans, I'd be poorer than poor. So here are some resources for stimulus check information from CMS and from the National Center on Law and Elder Rights. So Kathy, thank you. We're gonna hold questions and get back to you at the end. We're thrilled that you shared this information about the stimulus checks and other things that's happening in the small but mighty state of Rhode Island. And at this time, you're welcome. At this time, I would like to turn things over to Bev from Ohio. Bev, take it away.
Hi, everyone. Great to be with you today. So Carol asked me to talk about how we are using resident and family stories to inform our systems advocacy. And so after I recently gave some testimony in the Ohio General Assembly, I sent her my testimony, and so she asked me to join you today. So I'm just going to kind of talk about how that came to be and how I prepared. Excuse me, I've got some sort of allergic reaction to something. I've been coughing all afternoon, and it is not COVID. Okay, so the House Aging and Long-Term Care Committee in Ohio started receiving testimony. They actually called it informal remarks about COVID-19 because there wasn't any specific legislation that we were commenting on. They just wanted to hear from the world about what the experiences in long-term care have been. And so, as you might expect, many long-term care providers testified in their first hearing. And there was a family member that was very compelling, a couple of family members, very compelling, talking about their experience. And I was so happy to see that. And then I was invited by the committee chair to also provide testimony. The families had mentioned working with the Ombudsman, and so they wanted more information about the role of the Ombudsman. So I took that as a great opportunity to continue telling all of the stories that we've been hearing about people's experiences in long-term care, both nursing homes and assisted living and group homes, all of those things. So I just thought I'd kind of outline for you how we prepared. So my first step was to ask our regional ombudsman staff to send me stories. So we've been meeting with our ombudsman representatives 3 times a week by teleconference or webinar. And we recently reduced that to 2. I think they were getting tired of hearing from me. But we spend most of that time together, an hour to an hour and a half, talking about what they're seeing. They might ask questions, I provide some updates, and then I really ask them to tell me what's going on, what have they seen happen, good stories, bad stories. I try every Friday to get them to tell me good things to start the weekend. And sadly, that's a little hard to come by, as we're all ombudsmen. We understand that, and it can be very stressful. So I asked them, so I was aware of some things going on, of course, and then asked some ombudsman for some more detail on specific things, or I would just get news stories from them. So I got many of our ombudsmen sent me things from conversations that they had had with families, video chats that they had with residents, providers that were being especially helpful, with video advocacy, providers that were especially challenging. And so it really helped me put together a picture to inform our legislators about what was happening. So the next thing I did was to review all of the members of the committee. And this is always a good idea when providing any advocacy, any legislative advocacy, testifying, writing letters, anything that you do with a legislator, is to review their biographies. Hopefully your legislature has a website that includes biographies of the members. You want to look at what district they serve, and then, so I did that, and there is my robocall for the week. Or for the day. So I did that and looked at, made sure that I included stories from their district. So of course, you know, not all legislators are there, so just the specific district. So I included stories from those districts in case they had specific questions, and my testimony didn't include all of the stories, but I had them handy in case one of the legislators asked me a question about something. Then I could refer back to the story from that district to provide an example in answering the question. The other reason to look at their biography is to see what their interests are. What other committees do they serve on? Have they received any awards? So, you know, if they've received awards from maybe a provider association, or if they've received awards from, you know, children's groups, or groups serving older adults, or veterans groups, then that kind of lets you know what their interests are and what kind of messages they champion in their representation of their constituents. So in this case, 2 of the members of this committee are also on the Ohio Elder Abuse Commission, and I'm a member of that as well. So I'm a firm believer in not doing things for just one reason. So knowing that on the Elder Abuse Commission, we talk a lot about adult protective services, and in Ohio, APS doesn't go to nursing homes. So a lot of the elder abuse discussion that we have on the commission is in the community, and there's not a lot of attention given to abuse in long-term care facilities. So I wanted to make sure, knowing that a couple of the Aging and Long-Term Care Committee members were also on the Elder Abuse Commission, I wanted to make sure that I mentioned some situation of abuse in my storytelling. And that way, with the Abuse Commission, they would remember that at a future meeting, and they too would be interested in addressing abuse in long-term care facilities as part of the commission work. So that was helpful as well. And then, so that's kind of preparation for the testimony. And then delivery of the testimony, I had to give them written testimony, which, you know, can be as long as you want it to be. And because my remarks were limited to 5 minutes, all of the world, they had a lot of people testifying, so they limited remarks to 5 minutes. And so I also developed, so I provided the written testimony ahead of the committee hearing, and then developed separate oral testimony. So I took the written, boiled it down, the really key things that I wanted to get across to them. And then during the testimony, a couple of times I would say, so in my written testimony, you will see, and then that allowed me to draw their attention to it, but then move on to another topic. It's also important in delivering testimony to acknowledge other people who have testified. So a lot of the testimony, as I said, was from long-term care providers. And so, you know, I said, you know, I want to be clear that my role is to hear problems. And so I'm going to tell you today about the problems that we've been hearing. You've already heard from providers who have given you examples of the good work that they have done. So I'm here to tell you the consumer experience. And so it acknowledges those who have testified, lets the legislators know that, you know, you're fair-minded, but you're very clear about your unique role and what you bring to the conversation. Because my testimony that particular day was unique, I was the only consumer representative testifying that day, and I think there were 11 of us testifying. The chair was very gracious and gave me 8 minutes. I didn't realize, I just kept talking, and he never interrupted me to tell me that my time was running out. And then when I went back and looked at the recording, I saw it was like a little bit over 8 minutes. So he was very gracious in acknowledging the unique role of the ombudsman. Making eye contact when possible, and ending the testimony with things that were actionable. So I ended my testimony with examples of things that we've learned, like we've been talking for years about consistent assignment and the importance of consistent assignment in long-term care. And so I said, you know, during COVID-19, facilities have been forced, as they are cohorting residents and cohorting staff with those residents, to really focus on consistent assignment of staff, and that's something that should last. One of the other things that we have seen that has been a long-term concern of mine, this gave me an opportunity to talk about it, was in assisted living waiver facilities where there are residents who have a nursing home level of care, but they are not required to have state tested nursing assistants. For all of you others, that's a CNA. In Ohio, we don't call them that, but they're not required to have CNAs in assisted living. So when people started getting COVID-19 and needed a little bit more help, the assisted living facilities just wanted to send everyone to the hospital because they didn't have adequate staffing. So that provided another opportunity for me to talk about something that's always been my position about staffing requirements in assisted living. So it was just a good opportunity because people were listening about COVID-19, using the platform that you usually have and connecting it to what their particular interest was. And then provided a resource. I gave them a kind of a one-page description of the Ombudsman program that was originally drafted for legislators that provided our statutory authority and in a way that they typically like to see things. And so, and the committee chair made sure that the members were aware that they had that on their iPads. And so that was very helpful. And then the last thing is just to follow up. You know, there were some questions asked, and so it's important to follow up with those legislators to respond to their questions, make sure that they know that you're around and are available to help their constituents with whatever kinds of complaints or calls that they receive. That's it for me, Carol.
Bev, thank you. And I really highly encourage everyone to read the written testimony and even the oral. I mean, they're, as Bev said, one's longer than the other as she tried to shorten her information. But I think a great example of communicating with policymakers is such an important part of ombudsman work. So thank you, Bev. Katie, we're going to move on to so this is just some examples of communicating with long-term care staff. There are some check-in questions. The Iowa program called facilities and had a kind of a list of questions they were asking. Facility interviews from Georgia, and then another public service announcement, not another, but a public service announcement with the state of Maine Ombudsman program, along with the industry, did a short video honoring staff who were showing up and doing the work that needs to be done. Next slide. Next slide. Next slide. This is the tip for Ombudsman program communication that, like I said, just came out. I guess technically it came out last Thursday or Friday, but it is on our website. The link is here on the slides. This document talks about and has great ideas and resources from across the country for communicating with various stakeholders that the Ombudsman program works with. Next slide, please. And obviously, one of the things that's come up as Ombudsman programs are getting complaints, there are new things that have come up during COVID. So this is the Ombudsman reporting system, frequently asked questions, that I highly encourage everyone to look over these questions and make sure that if you have any questions that you're asking your state ombudsman for guidance as you put in whether something is a complaint or a information and referral. And we're going to be adding additional FAQs in the future, so we will send out that information when we add stuff. Next slide, please. We do have the COVID information on the National Ombudsman Resource Center website. You can find things specific to Ombudsman, but there's also, and from Ombudsman programs, but there's also a link here to the CMS Administration for Community Living and Consumer Voice. Next slide, please. And the Consumer Voice also has a COVID-19 information page, information for advocates, and information for residents and families. And both of the links, again, are on this slide. Next slide, please. The Consumer Voice has a resource that has information for every state reporting whether or not the state is reporting cases and deaths by facility, whether it is reporting assisted living information. So we might be adding a couple other categories on here. So highly encourage everyone to be familiar with this document. You can look and see kind of where things are in your state. And again, if you have any questions about where the policy is about reopening and reporting of information specific to facilities. I encourage you to ask your state ombudsman. And of course, the state ombudsman are going, ah, do I know that? So next slide, please. One of the things that we know is that one size answers don't always work. Hopefully you've written down one or more ideas of things that you might do to communicate better, to present advocacy ideas better, and you'll maybe get together with people in your state to see if that's something that you want to start working on. We sure hope that you will continue to share your stories with the Resource Center so that we can continue to be the hummingbird or the honeybee that actually it's the honeybee, that takes ideas and sends them out, kind of that synergy atmosphere. Next slide, please. October is Resident Rights Month. We are going to do it, even if it's not the normal way. Connection Matters is the theme. Highly encourage you to go out, take a look at especially the Residents' Voice Challenge, and encourage residents in your facilities to submit something. You know, it can be pictures, they can be letters, they can be poems, they can be songs, it can be one resident, it could be the whole facility. But we really want this year more than ever to try to engage as many residents in as many facilities as possible. Next slide. We hope that you are receiving the Ombudsman Outlook, which is a quarterly newsletter. It'll actually be coming out the first part of July, and the NORC Notes, which come out the end of each month or the first day of each month. I can't remember which one it is. But if you are not getting those resources directly to your email address, you can sign up by going to this link that's on this slide. Last slide, and Libby, if we've got time for a couple of questions, so everybody get ready to unmute so that multiple people maybe want to join in on the questions. So Libby, go ahead.
Sure. This first question is directed for Kim and Carolyn. How did you get your contact information for family members?
Well, hi, this is Carolyn. I was trying to quickly unmute and I don't know if I did it right.
Yeah,
Can
you're
you hear
good.
me? Okay.
Short answers, everybody.
What we used was when family members were contacting us for information and assistance, most of the time we were obtaining email addresses so that we could send them information or we could dialogue. So that was our starting point. And then we asked our local ombudsman that whenever a family member calls for information and assistance, to tell them about the council and collect their email address so that we can include them on future emailings. And that's how the initial list grew.
Great, thank you. Libby.
Another question, this is more general, so for anyone who wants to answer, can someone explain telepresence robots more thoroughly?
So I'll jump in unless somebody else is trying to. These are, I don't know how much they cost. And Carolyn, I was thinking it was somebody in Pennsylvania that actually got one.
It was Dory Taylor, one of our other regional ombudsmen. I think, I'm gonna say it was around $1,000. I'm not 100% sure on that. I know they were looking at using some CARE Act money. They finally got the one they ordered. They're test driving it now, literally. They're taking it to check range and commands and all of that. But it basically goes around the facility with an iPad attached to it. And of course, the ombudsman is logged into the iPad and that's how they dialogue with residents. A lot of logistics, but I will put Dory's email address in the chat so that you can go back and forth directly with her.
Great. I've seen a picture of it. It's very, it's like a computer screen
Mhm.
on an IV pole.
Mhm.
And that's kind of what it looks like. And
Yes.
it kind of would come up, and I guess it could be right next to the bedside.
Mhm. Yep.
Pretty
It's
cool.
nice too because you can adjust it to varying heights, Carol. So it could be at wheelchair height or standing height or bedside height. So it literally can move about the facility and we can adjust its height and where it goes from remote.
Yeah, and I think everybody thought telemedicine was the next thing. We're gonna have tele-ombudsman.
Yep.
Libby, let's do one more question.
Sure. For Kim Palmore, how did you handle facilities with second floors when you were making your visits?
Can you repeat that, please?
Sure. How did you handle facilities with second floors when you were making visits?
You know, I don't think we went to any with the second floor. I don't have any two-storied facilities in any of my 9 counties.
You know, that's the difference. We sometimes forget that every nursing home isn't just one floor. Because I'm from Missouri, and in the big cities, they have multiple floors, but typically every place else, there's enough property that, I don't encourage people to get ladders and climb up. I think the question there would be, one of the questions you would be wanting hopefully to ask staff, your contact or the administrator, how are you getting people on upper floors down so that they can have that window visit, or they can have an outside visit? I think that's so key. Listen, I want to thank Kim, Carolyn, Kim, Vicki, Kathy, Bev, for your great ideas. For all of you who chatted in, we will follow up with as many of you with answers that we weren't able to do live. We thank you for your commitment to being the spokesperson and the ear to listen to residents and to share their stories. With that, I want to thank Libby and Katie for helping out with this webinar, and remind you that just you are so, you are such good people to be this committed to helping your fellow man. And I hope everybody has a great rest of the day. Bye.
Bye.
Thank you.